This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
We are back.
We are,
John. I slept till 8:30 last week.
You told me. And I actually, John, you know what? I'm so used to being in the office by 8 that I couldn't, but I didn't. I want to say that I missed our conversations, and it was a little weird to get up Sunday. Yeah, but I was glad we did it because you and I really worked.
I think we're going to do a show now.
We are.
It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question at any time during the course of the show, or you have a medical challenge you want to run by Dr. Molly, you can call in at 855-839-1210. That's 855-839-1210. We're running a little late this morning, so we'll catch up eventually here. But let's talk about Innovative Medical and how it's different.
So, first of all, let's talk that we are a collaborative group of like-minded practitioners, and we all work out of my primary care facility in Marlton, New Jersey. So we can do anything a primary care doc office can do, but we actually do more than that because we're big believers in God's ingredients. So if you're on some medication for your blood pressure, or you have a problem, cardiac problem or cholesterol problem or whatever kind of issues, we of course can take care of that with the pharmaceuticals. But our real focus is on helping you reduce your need for pharmaceuticals. I'm not saying to throw away your pharmaceuticals, but I'm saying if we can help you reduce your need for pharmaceuticals by the use of hydration therapy as a vehicle to really input natural substances, things like vitamins, minerals, amino acids, even some herbals that can help augment your pharmaceuticals and reduce the amount you're taking, and do what? Stop the side effects from the drugs themselves as well as your condition.
You know, you and I were talking before the show, and we talked about my stroke in August.
Oh, yes.
And you said to me, and I think it's a very significant thing, imagine if I wasn't coming into your place twice a week.
Right.
For all that time, and continue. Imagine where I might have been, because I've basically done a full recovery.
Absolutely, John. And actually, you did probably an 80% recovery soon afterwards.
Right.
So, I mean, for me, that's significant because fundamentally, really, you and I only missed a conversation for about 4 weeks.
Yeah.
That's incredible. Let me tell you, that's incredible, given the stroke that you had and the fact that we were able to jump on it. But again, that's doing both what I believe in, which is conventional and integrative, meaning bringing in the natural substances. And also, it's a testament to what we do because I see you, not just here, but I see you at the facility, and we're able to really jump on challenges early on for patients, and that's important, and get them to the right specialty they need, or get them to another physician, or get them to the physical therapist they need. These kinds of things are done out of my practice all the time.
I've noticed a lot of new patients
at
your facility.
Yeah.
I mean, a lot of new faces that I don't even know half of them. So it goes to show they're coming in.
Sure.
But what can they expect as new patients as far as their treatment is concerned?
Well, you know that I individualize all the treatments. I mean, that's the bottom line. First things first, come in for the free consult, because at that point, we can go over some of your challenges. You can tell me what your goals are. That's important because, again, I'm all about what? Quality of life, John. No matter where you are in your syndrome condition or whatever, we want to know what are your goals and what you want to see improvement in your quality of life. And can we help you get there by either helping you reduce meds, changing the meds up if the doctors so think, and also augmenting with more nutritional supplements.
We are coming up on our first break of the morning. It's Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. I'm John DeMasi with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number in the studio, 855-839-1210. That's 855-839-1210. We're coming back with more of today's edition of Health Watch after these words. As always, operators are standing by at Innovative Medical Associates. When we do the show, they're there, and they will be there well after we leave you at 9 o'clock. The number is 856-489-0505. Again, 856-489-0505. That's the number for Innovative Medical Associates, located in Marlton, New Jersey. And when you call, you want to make an appointment with Dr. Molly, the initial consultation is complimentary, and you can really find out a lot about your condition and your problem by doing that. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And before we get back into the show, it seems like this week everyone was asking me in the clinic, how do I get the old radio shows? So right. I was explaining. So here's what you do. You go to the website, innovativemedicalassociates.com, and you'll see a little icon at the top that says radio show. And you click on that, and all the shows come up. So you can listen to any of the shows at any time.
And it actually tells us what we spoke about that day, which is really cool.
Yes.
Thank you,
So
John.
you can do that. 855-839-1210 is our number here, 855-839-1210. We're going to talk about our old friend.
Vitamin C. John, one of your very favorites, but it's been interesting because I did a little archaeology on vitamin C, and we all know about Linus Pauling. I don't think there's anybody that ever comes into my clinic that doesn't know he did the original studies. But we also know that Pauling and Mayo Clinic had different results, and this was done before the 2000s, the year 2000s. Well, what happened is it's becoming rekindled because of patient-driven, right? Patient-driven. So you folks out there, the listeners, are redriving what medical thinking is saying about vitamin C, and this is an important piece. So we know the discovery and isolation of vitamin C was one of the most important advances in improving human nutrition, thereby improving quality of life. We know that. But when we looked back at the old studies, why did Pauling have one thing and Mayo have something else? Well, of course, it all started with not only the dosing, but the delivery system of vitamin C. So commonly, it was delivered orally. And of course, they couldn't get a particular therapeutic level orally, and then they switched over. So right now, in the year 2020, there are intravenous high-dose vitamin C studies going on right now from two scientists, one from Cornell and one from Baylor. And you can see the initial study from 2020 from the National Cancer Institute showing that vitamin C has definitely helped improve and rekindling vitamin C therapy as a particular treatment. And this is what the study's saying. The study was as a treatment for cancers, not just as an adjunct treatment, but as a treatment. So again, this is from the National Cancer Institute, not from Dr. Molly's clinic. But what I'm saying is in our clinic, interestingly enough, if you go back to the old studies, where did we extract vitamin C from? We extracted it from the fruits and vegetables, right? The citrus fruits. So that's where I started to believe the differences in vitamin C make a difference for outcomes. So imagine utilizing the God's ingredient, vitamin C, extracted from things like tapioca, cassava, whatever, depending on what I'm using it for, and utilizing that for the patients and sort of mimicking Linus Pauling's work, the original work. And I would tell you that, of course, in our clinic, we use it extensively to help people improve their quality of life. And we are finding that actually we're doing a pretty good job. And the synergistic effects of vitamin C with radiation and standard chemotherapies, we can minimize pain and protect normal tissue. And I will tell you that you will see that by the end, let's say, of the 2020s, we're going to see that vitamin C is going to be used more often, hopefully, from traditional oncologists.
Well, you believed in this way back.
Oh, yeah,
way
27
back.
years ago.
Way back. But what changed in 20 years in this particular study?
Well,
That's
I
what
would
I'm
say
curious
no,
about.
I would say nothing, and I would say what happened is the differences in the route of delivery is the big key. The differences, and I think two really smart scientists, because they're scientists, they're not necessarily physicians, right? They're scientists, looked at that and said, wow, well, we're not really mimicking the original study. We're really doing something different, and therefore you can't compare apples and oranges,
Yes.
or in this case, oranges and lemons if we were looking at citrus. But the point is, we want to look at this and say, okay, we're finding out that really if we get the plasma level up to a therapeutic level, what's the best way to do it? IV. And therefore, it's coming out that, you know, you're going to see that vitamin C as a therapeutic option. I think we will see that in the next 20 years, that vitamin C will become an absolute, maybe, if God is good, a standard of care as well. Right now is not the standard of care.
What does the National Cancer Institute have to do with any of this?
Well, the National Cancer Institute gets a lot of money to pursue, cancer therapies and what kinds of things can help our patients or people with cancer to utilize certain things. And I think there's also a component of this. How do we make cancer treatments more cost effective? And we all know that the chemotherapeutic drugs are extremely expensive. And I would say that the government is looking at that in the long haul because more and more of us are getting to the age where cancer is becoming more and more of a problem. But the National Cancer Institute has the grants, have the government funds to really look at this. That brings me to another interesting thing because, you know, I read all of the European studies. And in looking at vitamin C in the European studies, guess what they used with it? Mistletoe, you know, the stuff we used to hang out, okay,
and kiss
get
under.
Get a quick kiss at the Christmas time. Well, they actually were using this, and it was a very interesting study. They were using this on supportive cancer care, the association of complementary methods with quality of life and life satisfaction in patients with gynecologic and breast malignancies. So that was the goal of the study. And they used with this was a CAM study that was again done by the official government website where they were using mistletoe along with vitamin C for these studies. And they found that there was definitely improvement. And also, they did another study with the addition of mistletoe extracts for patients compared to conventional treatment alone about the efficacy, safety, cost-effectiveness for patients and social and ethical issues. Now, that sounds like a lot of mumbo-jumbo, and it is really. What it's saying is that putting the mistletoe in with the chemotherapies and other traditional treatments has shown that it is not contraindicated. And this is being done out of Germany and the European markets extensively. Now, of course, you will not get that from your oncologist, I can tell you that. And there is a problem in the States with securing mistletoe. So I just am putting that out there as a fact for people to know. The European markets are doing this, and the government is finally looking at that and saying, can mistletoe extracts help folks with cancer?
Why is it that we take you've been studying these European studies, and it seems like a lot of information comes out of them, but we don't translate it here.
Well, hey, John,
I don't understand that.
Didn't we have a famous guy who used to work with us who'd say, follow the money?
Yeah.
Do you remember
that's
that?
Right. Yeah.
I mean, that's not Molly saying it. I often quote him, and you and I both know he was a big deal in the Philadelphia marketplace.
Yes, he was.
And I will tell you, I think that may have a lot to do with it. But the other thing is, we are slow. I mean, I think science is rapidly advancing in terms of nutritional science. But again, medicine, with the premise takes a little longer because application of all of these scientific studies is different than utilizing it on patients. And it's difficult because the studies are hard to do because how do you wrestle up the patient population for that? Like, how do you give somebody double-blind studies when they have cancer? You want to give them the best chance. So what happens is many times the studies are flawed by just the patient population.
Has there been a lot of studies in the last 20 years? You mentioned...
Oh, yeah. Over 300 that I was able to just find. The search results from PubMed. Over 300 or so studies from 2000 to right now. So can you imagine all the studies that were done before 2020? Okay?
That's a lot of studies.
A lot of studies. So there are many, many recent, and utilizing vitamin C in and of itself. And again, our extracts are very different than commercially prepped ascorbic acid. So what I'm saying is you'd be surprised at how many studies in various types of syndromes and conditions vitamin C was studied, and there are lots of them. And for the majority of these studies come out in favorable for the use of vitamin C, at least in that it does no harm, assuming that a patient has the enzyme to break down the vitamin C. And that's something I study in each and every patient that comes in. We run that enzyme.
So in the early 2000s,
yes,
the study said one thing, and then
these
later
folks,
on,
yeah.
it
well,
changed.
because they changed the study.
Oh,
when you change,
okay.
right, when you change criteria, you change outcome. The old story about figures lie, liars figure. Well, honey, you've got to look at studies like that because it has to do with the criteria, the review, the meta-analysis. So it's a little complex. But I urge most of our listeners who are very intelligent, they can go on PubMed and read for themselves these studies and make informed decisions. And that's what I like when patients come in for the free consult. Not only I can reference, here's the thing. It's a double-edged sword, John. I can reference a study that says, oh, my goodness, it works in this condition. And then I can reference another study earlier or later that said it doesn't. Bottom line is I can talk to the experience we have in our clinic.
And with that, we are at the halfway point of the show. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. And we do have some open lines right now, so you want to get in here, you'll get on right away. 855-839-1210 is the number. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We will come back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and the number 856-489-0505. You may want to write that down because you say, I'll call later on, then you forget the number. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. The show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. We are going to go to the phones and talk to one of our favorite callers, Frank in the Northeast.
Hey, Frank.
Good morning.
Hi.
That person, Father Money, is that the legendary Irv Homer?
You bet. You bet. And don't you think he was right? Even today, God rest his soul, even today.
He was a master. People try to imitate him. We never duplicate. That guy was the best of the best.
Yeah. Yes, he was.
Yeah.
Yes, he
no
was.
Dr. Molly, yeah, Speaking of the best, last week, did you hear your best of show last week?
Actually, I don't think I heard that. No.
I didn't either.
Go ahead.
I was
Dr.
sleeping.
Molly, you were sleeping, John?
Yeah.
Dr. Molly, you have to follow John's advice. Go to your website and look at radio programs. He goes, last week was truly the best of. It was a tribute towards you, Dr. Molly.
Oh,
John the barber started it off from, I think, Mount Laurel. When they thought your people thought he missed his appointment, how great your people are, and called out.
Oh, yeah. That was very cool.
That was a great son. Yeah,
that was a great show.
Right.
Yeah.
Right. And then some clown from Northeast Philadelphia named Frank, I don't know the guy, but he called in Joseph.
No. You were very kind. You were very kind that day. Yeah, Pam called in.
Yes. Who saw he's going to be a baseball star someday. And
yes,
we
we
were all talking how great you are. So try to listen to your own program. It was a tribute towards you, Dr. Molly.
Thanks. You know what I say. I say all the time. Listen, I don't necessarily fall for my own press. Okay, what I try to do is I try to have a balanced kind of mindset because really the most important thing in our facility is our patients. They make it. They make it happen. They allow me to really, I have a privilege there. And I got to tell you, between that and my physician, so I really feel that it's such a privilege to help folks through their journeys, no matter what it is. We can't cure you. You know that, Frank. But my God, we're going to try our best to get you to somebody who might be able to help you. And also keep your journey, keep your quality of life while you're going through that journey. Because God knows, you've been through a lot yourself. So you know what it's like to tackle what's going on today in healthcare. So God bless
Dr. Molly,
you.
Last year when John had his incident, I think it was August.
Yes.
I mean, he's a warrior too because Paul Perillo came in, but John was in the studio sitting next to us all.
Yes,
he
was.
He didn't want to miss part of the game. He's a great guy, John.
No.
Thank you.
And I appreciated Paul Perillo as well, but I will tell you, obviously, John and I have a friendship off of the air as well, and he's been a patient of mine for almost 20, right, John?
That's right.
Right.
20 years.
We've been doing radio shows that long, and I got him through a couple of bouts of stuff, and I told him this is it now. He's got to stay healthy. So let's keep it.
And by the way, Frank, Irv Homer was at Dr. Molly's facility and did a few live shows there.
Yeah. Back in the day.
So thanks for the call, Frank.
Thank you. That's a great trip down memory lane, too.
Yeah,
it really was.
Really is.
Yeah.
855-839-1210 is our number here in the studio. We're going to talk about pots. And
yes.
That's not the kind that you cook with.
Nor is it the
other.
Italian.
Right.
That means you're a little bit off.
Yeah, right.
Okay, no, not those pots. What we're talking about is actually an autogenic problem, meaning an autogenic, which means your nerves, something with your nerves. And it is really a very interesting type of syndrome. I have a belief that it can be spurred on by viruses because I read some articles that said people who have POTS, and I have a patient right now, a young man, most times they talk about it being spurred on by stress. Well, I believe it can be brought on by stress, but we're finding that it can also be brought on by some viruses. And in treating this young man, I tested him for some viruses, and it really showed me that he had things like Epstein-Barr. So POTS often gets misdiagnosed because, again, there are certain inflammation markers that cross over POTS and other autoimmune disorders. So when we look at this in our clinic, of course we want to get him to a POTS specialist, of which there are not many. But generally they come out of cardiology because it actually affects your autogenic nerves, meaning your nerves that actually work on heart, and syncope, meaning how you can have tachycardia. And you and I know that we see sometimes in older folks where we have this postular, right, fluctuation of our blood pressure, where when we get up from sitting, you've heard this, after a certain age, when we get up from sitting, to standing, or from laying down from our bed to sitting to standing is often told to do, because we have an effect as we get older on our nervous system that affects our blood pressure and cardiac, meaning tachycardia, those kinds of things. So POTS has all of those symptoms, plus has the fatigue, has all kinds of comorbidities that include both GI, and it can include depression because there is a problem. So it's not just the orthostatic tachycardia. It's more than that. It is the fatigue. It's the lightheadedness. It's the weakness. And my patient is a young man, as you know, probably in his 20s.
I've seen him.
Yes,
I mean,
he looks bad.
He's
Now,
a baby in the clinic.
That's right. And what's happening is he has to go in to see a physician to do a tilt table test. You know why? They're going to lower him and change the position of his body to see what happens in terms of the orthostatic, which is really run by our nervous system, which means it makes our blood pressure go from head to toe. I'm trying to make this as simple as possible. It's not. But looking at that, and then also there is an autonomic test out there that's done by cardiology, and then the results of that test, along with some other blood results, can actually definitively show that you have POTS. But my feeling is this young man has been misdiagnosed until he came into our clinic. I am a firm believer that he has POTS as a cofactor to some other autoimmune disorder.
I'll bet you that you're going to tell me that vitamin C has something to do with this.
Well, vitamin C is important because why? It has the pro-oxidant effect and the antioxidant effect for things like the inflammatory markers. So in studies, they've demonstrated elevations of interleukins that are absolutely high elevated in some conditions like rheumatoid arthritis and some other conditions like scleroderma, this type of thing. Well, there are also the development in POTS. So we really need to look at the dysregulation of the nerve fibers. What's going on? These elevations. People who have SLE, right, also have elevations in this. So we look at this and we say, okay, what's going on? And I think it's a mixed etiology condition. That's my point. And up until I did some research, I was finding that only the large facilities, meaning places like Mayo, Cleveland, this kind of thing, are doing a lot of research in this because there are not many people that have POTS. And it affects more women than men. I just happen to have an outlier. I have a young man. And then they really think, oh, it's in his head, but actually, or it was stress-induced in his head. I really believe this young man has a post-COVID-19 syndrome that maybe started this, and the virus, another thing that we're seeing, these viruses, not just Epstein-Barr or HSV, the herpes 1 and 2, but actually looking at COVID virus and some of the folks that are having some of these problems.
Are post-COVID patients susceptible to this?
Or some form of POTS. Yes, I believe that. I believe that that's really started it for this young man.
So what would they do?
I would say they come in my chair and do a post-COVID treatment protocol, but a little differently. I might want to look at also their vitamin deficiencies in the moment, because there's also a link between vitamin B1 deficiency in people with POTS, which actually I've seen in this young man. And testing the vitamin deficiencies might be another way to improve significant improvement for POTS. The other thing that's interesting, John, is I'm seeing that, this young man has come to me and he said he has depression. Lots of my post COVID-19 patients suffer from depression too, because there's a lowering of serotonin that's available. There's a deficiency of serotonin made outside of the central nervous system. So it's very complex. And then we'd have to put him on things like maybe tryptophan, this kind of thing. Certainly NAD is some of the things we would use in the POTS syndrome. The other thing we might want to look at is we want to look at the entire etiology of his inflammation cascade and see if he sort of slides into things like fibromyalgia and chronic fatigue as well.
Why is it so hard to diagnose this?
Because it mimics so many other things. It could just be orthostatic blood pressure. In other words, you just have this condition that we see in the elderly. But generally in a younger person, I would say it's more likely to be POTS. And it would be interesting. You really need to look at a complete review of the medical records for a patient like that. Now, another interesting thing about POTS that we do, we use a subclinical dose of a particular type of pharmaceutical. And it's been very interesting because it works on the GI tract as well. And we've used this on this man, and he's saying he is getting a little bit of improvement along with the IVs. And actually, I'm going to be speaking about that next week a little in more depth about the subclinical dosing of this particular drug, because I'm speaking on it in a couple of weeks at a convention about this. But I am telling you that this POTS is complex because, again, you look at a myriad of issues, and most times it goes undiagnosed or their patient is told it's in their head.
We are coming up on our final break of the morning. You still have time to jump in here with a question or a medical challenge you want to run by Dr. Molly. 855-839-1210 is our number here in the studio, 855-839-1210. It's Health Watch every Sunday, 8 till 9. Featuring Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We are coming back with more of today's Health Watch after these words. We are back here on Health Watch, and operators are standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. Hey, they work. 856-489-0505, 856-489-0505 is the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we remind you, if you missed any of today's show, if you want to just hear it again, you liked it so much, well, you tune in at 4 o'clock this afternoon. It's our Health Watch replay, 4 until 5 this afternoon, here on Talk Radio 1210 WPHT. 855-839-1210 is the number here. We have a few minutes left of the show. If you want to get in here with a question or a thought for Dr. Molly Fantasia, feel free to do so, 855-839-1210. I want to talk about one of our long-standing patients.
Loyal patient.
A nice guy, and I've had many conversations with him.
Well, yeah, you know what? Well, first of all, once you're a Marine, you're always a Marine, and God bless Harvey because he's the quintessential Marine.
Yes,
today,
he is.
right?
Yes, he is.
Okay, and we're talking about what, 40 years ago? I mean, but he's a great guy, and he's been wonderful to the clinic, and he's become a personal friend of mine in doing so, John. But this was interesting. Last week, he came to me, and he said, I've got this black and blue on my chest. And I said, well, let us see it. I said, let's go in the exam room. Let's look at it. So I had one of my registered nurses look at it, and I looked at it. I said, I don't like this. I said, let me key in one of the docs, and I did. And I said, I really would like to get him over for some testing on this. I mean, I had done the blood testing to see if his platelet count was okay or whatever, but I didn't have it back yet. And obviously, I sent him over. I said, I think he needs a mammogram, like immediately, right? Would you believe my entire staff went into action? Barbara called the radiology people who were up the street from us. And by the way, generally, I'm able to get people in for radiology fairly quickly. Not always, because I have to depend on the radiologist. But we got him in not only for the radiology, the mammogram, through the Women's Center, by the way, we got him in to get the ultrasound done simultaneously so that we had the full report so that the doctor could review that as well. I was very worried about male breast cancer. And do you know why? He was at Camp Lejeune. And we know that, I went immediately into thinking about the toxic exposures. I just can't help it. The scientist in me started thinking all kinds of negative thinking, which I didn't like. But Harvey's a smart guy. He was thinking that way as well. So he didn't hesitate. He said, I don't care. He said, I'm too much of a man to worry about going into the women's center. I said, I agree. Just get there. I said, you're still a catch, brother. And he laughed. He said, yes, I'm going. And thankfully, he went. We got the report the same day because we acknowledge this is an important issue. We went, it's negative for male breast cancer, which was a big relief for me. But then I started to think and looked over the chart and said, well, what could be causing this bleeding right under the skin? And sort of this lumpiness in the fat tissue. And lo and behold, it seems that he goes to the VA, and the VA took one of the medications that we used, a non-generic. We used brand name and changed it to the generic that is on the VA list. Well, I looked at that. I did some research on it, and indeed there was some differences in the mixture that could account for some bleeding right under the skin. It did have a little bit of data out there to show that.
So the question is, why did the VA change his medication?
Well, I can't answer that because I'm not Secretary of Health, but it would seem to me that the brand name was more expensive. And as a veteran, you're entitled to get your medication at the VA, actually at the VA clinic or the VA hospital. But the thing about that, John, is you can only get medication that's on the VA list. So in most cases, it's a generic that is on the list. And of course, he didn't know. He thought it was the same exact thing. And it certainly is cheaper to do that. And when you're on fixed income, of course, you look at things like that. But, this is what goes on right now. So my point of this whole story is, do you think he could have gotten that kind of care in a spa where they're doing drunk tanks and, beauty IVs?
No way.
No way. Here goes back to my point about going to a medical hydration facility.
And that's why you're who you are.
I'm just saying, tells you, but why? Because we get involved in our patient care. I'm interested in knowing what's going on. My nurses are interested in knowing what's going on. We want to follow a patient through their continuum and their journey through whatever conditions they have. And he was on an antiplatelet. He was on something that we named brand name. They changed it to generic. The generic had some side effects that the brand name didn't necessarily have, and in his case, it translated into a bit of a problem. What I really want people to take away is, you come into a facility like ours, we are fully entrenched on the actual medical piece of this. When we look at nutrition, we're looking at it medically. What can it do for this patient in this particular challenge at this particular time? And very different, I think, than just going on and taking one from column A and one from column B.
I've said this many times. You spoil your patients.
I can't help it. We just can't help it.
You really do.
We just can't help it.
You wouldn't get this kind of care from anywhere else,
as
I see it. Anyway.
And the way I am very, very thankful to my physicians. I am very thankful to my nursing staff. I'm very thankful to my nursing assistant staff. And just all the way around, it's really important to have people who actually care for each individual and not just see you as your condition. The bottom line is, you can have a multitude of challenges. And the other thing I want to say is I'm very cognizant of the fact that there are certain nutraceuticals that can interfere with your medications. And we definitely, every week before the orders are out, we're going over it, and before you get in the chair, we make sure that doesn't happen.
We have a couple of minutes left of the show. Maybe one more story of a patient?
I've had so many. My group from Indiana has gone back back home. I have spoken to them several times over the phone. One of them is doing extremely well. One is a little bit off the wagon, but I think I got him back onto the wagon. That was the one thing. And I have 2 people coming in from Florida this week that are coming in for our Lyme disease protocol because they've just gone through hell after having a spinal tap. He actually had to have a patch. He had a problem at the spinal tap level. So the poor guy was flat on his back for like 5 days.
You specialize in complicated problems.
We don't want to. Believe me, you can be sure that my medical director says, geez, can't we get something that's a little more simple? Like they have a hangover. I said, we could, but we're not.
That's right. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now, and they'll be there well after we leave you at 9 o'clock. And the number is 856-489-0505. That's 856-489-0505. Call and make that appointment with Dr. Molly. The initial consultation is complimentary, and you will learn a lot. And don't forget our Health Watch replay this afternoon at 4. If you missed any of today's show, you catch us this afternoon 4 until 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Catherine, Lana, and Donna. And then, of course, there's delightful Dee, fabulous Fran, Joanne, and our nursing assistants, Karen, Kathy, and Sandra. I'm your host, John DeMasi. Thank you for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, 8 till 9. Health Watch, Talk Radio 1210, WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.